as Channel Africa.
Thanks, Asanda, and good morning to you and your listeners.
Morning. What do you see as the biggest challenges currently facing healthcare financing on our continent of Africa? Let's start there.
And I think the biggest challenge, of course, is there isn't enough funding. And what scarce funding there is needs to be allocated to competing resources, healthcare being one of them, but there are other needs and requirements that governments and private institutions need to fund. So I think the challenge is very much one of not being enough funding to actually support the healthcare needs of populations across different countries in Africa, and competing requirements or needs from different aspects, like, for instance, education and other areas as well.
What innovative financing, or let's actually, before we get there, I outline the main sources of healthcare funding across the continent today. We know aid cuts from the US have impacted this sector as well.
Yeah, absolutely. So, main sources of funding obviously are government funding, being the first one. And just touching on that, the Abuja Declaration proposes that governments spend 15% of their GDP on healthcare. We're seeing a lower percentage than that being spent. But government is one of the primary funders. Then, of course, there's out of pocket from individuals paying for their own healthcare needs. But in addition to that, there is aid and donor funding. It hasn't completely dried up, but we are seeing a reduction in that. And then there's also funding from development finance institutions. You could think of the likes of the IFC or International Finance Corporation. And then, of course, there's commercial funding as well. That's provided by banks, could be provided by private equity firms, venture capital firms. So there's an array of funding that we're seeing being provided into the healthcare sector. I think one of the challenges that we face is that it is not necessarily all coordinated or managed in a way that maximizes the benefit to the population. I think more can be done across the different funders to work together to provide solutions that actually meet the needs of people.
So let's talk innovation then. In terms of financing models, what innovative models or case studies stand out as examples of success in Africa?
There are a few, and maybe I'll even start with the government. As much as people don't like it, levies or sin taxes on things like alcohol, tobacco, sugar are innovative funding mechanisms that governments use to raise revenue. Those need to be spent on the healthcare sector. That's not always the case, but that is an innovative funding measure. Then I think private or PPPs, public-private partnerships, are another area where I think more can be done and private capital generally, or private companies generally, are able to operate more effectively than government can, and that means a lower cost of providing healthcare. And it also frees up capital that government would otherwise have spent on healthcare that it can use for more healthcare or to spend on other areas. So I think those are innovative funding areas. I think another aspect that can create additional savings and therefore more funds to spend on other areas of healthcare is, of course, AI and digitization. It is a bit of I guess, a hot topic or buzz phrase at the moment, AI, but we certainly see that as enabling efficiencies and improvements in entities that provide healthcare, thereby freeing up resources to focus on other areas as well.
How can private sector investment be effectively leveraged to complement public funding and donor aid? You speak on the issue of PPPs. What else can be looked into here?
Yeah, so I mean, for example, so a commercial institution like a bank or a private equity firm manages capital on behalf of other parties, shareholders, funders, etc. And their primary goal is to safeguard that capital, but also earn a return on it. So when it comes to actually funding, there are different elements of a funding package that come together. There are parts that are low risk focused, which is where the banks and the likes sit. And there are other funders that can focus on more, I guess, the higher risk elements of the funding package. And what banks can do, and private equity firms and the like can do, is put in place packages together with, say, donors or government, in the case of PPP, where the lower risk element sits on the commercial side and the higher risk element sits on the donor or the government side. That means that more funding can actually be brought to bear on healthcare opportunities and healthcare solutions.
So, what steps are needed to make healthcare financing more sustainable if we look at this as an overview now, and also make them resilient for the future? What are you hoping will the takeaways be at this time, the World Health Expo in Cape Town?
Yeah, so I mean, the expo has been great for an exchange of ideas. There's lots of energy, people talking about, what can be done, how do we move things forward in the healthcare sector. And I think there are opportunities to work together more than has historically been the case. What we've seen is, I suppose, an element of working in silos. So a particular organization or government will focus on funding X and another one will fund Y. I think if we can work together more closely, there is potentially a larger opportunity to increase the funding and to ensure that more projects get funded. And I think that's something we'd like to see is a greater degree of collaboration in order to maximize the funding that can be put into the healthcare space.
Sean, thanks so much for your time. We'll leave it there for today, and all the best with the rest of that World Expo in the World Health Expo, rather, in Cape Town.
Thanks, Asanda.
Thank you. World Health Expo is underway in Cape Town here in South Africa, where we're speaking to Sean Wegerhoff, who is head of healthcare coverage at Standard Bank, talking to us on the line. Part of the discussions there that will be taking place as they continue this gathering, bringing together global and African leaders to discuss the solutions that are needed to rebuild healthcare systems on our continent. And he's representing Standard Bank there.
We are on open.